Good afternoon, everybody. It's Kate. I just wanted to take a second to go over the skills portfolio. It's the blue folder that some of you have already received. I just wanted to go through each section and make sure everybody was clear on how you fill it out and how we will complete it. This is a requirement for the course, and without this portfolio turned in, I'm not able to sign you off. So I just thought it might help if I went through it. What you're looking at right now is the Vermont EMS Student Manual. If you go to the table of contents, here on page 31 are the 32, the clinical requirements for advanced EMT. So let's do that. Make everybody seasick, go into page 32. These have not been updated. The clinical requirements for advanced EMT haven't been updated since 2003. So this is everything you need to do to complete the advanced EMT class. You'll notice it's missing intraosseous. It's missing some pediatric stuff. It's not super complete, but nonetheless, this is what we have to work with. Right here on page 33 are some of the things that you have to demonstrate for us. And then down here it talks about the different patient observations. So this is where the clinical skills portfolio sources the content that you're required to show us. You start with class skill sheets. So your portfolio is divided into class skill sheets, National Registry skill sheets, and clinical skills. Class skill sheets, National Registry, and clinical skills. Let me see if I can show you this in a different way. I'm pretty confident this is so painful to listen to, and I'm really sorry. I cannot seem to move this. All right, that's fine. So class skill sheets are identified by this header that says Vermont EMS District 3 AEMT class skill sheets. In order to perform a skill outside of class, you need to show us that you can do it first. That's just a safety thing. However, in the setting of a pandemic, if you have been formally taught these skills before, the students who were a part of the UVM class or the District 6 class, you can send me copies of your skill sheets and then get checked off by your training officer to start doing skills immediately in the field. Sorry, I had to cough up a fur ball there. For those of you that are taking the advanced EMT class for the first time, we just want to make sure that you've learned the skill properly in class, and then we encourage you to go back and practice at your service, practice on your friends under the direct observation of a service-approved preceptor, and then come back to us and we'll get you signed off for patients. So this is the class skill sheets. Those class skill sheets are the following: venipuncture. All right, you just have to have a couple witnessed by class instructors. If there's an issue with quarantine or with illness or anything like that, we're gonna be flexible with these class instructor sign-offs. Okay, so you know, if there's an issue with getting to class and you have the ability to get signed off back at your service, just talk to me about it. We'll get you taken care of. But this is the IV page. Here's an airway management page, and then the medication administration page. Alrighty, so we'll get through those, and every lab you'll see that something is listed that we'll be doing. Alright, the next, sorry, wrong page. Actually, the next set of skill sheets are the National Registry skill sheets. Those are the ones that you can find on the National Registry website. When you get a sign-off on these, we're looking for proficiency, that you've mastered the skill and you're ready to test. So the next couple weeks we'll be working on advanced airway. It may be that you demonstrate proficiency with the iGel in the next 2 weeks. If you want to get signed off as your class final proficiency sign off in airway in the next 2 weeks, that's totally cool. You can be done with it and get it done. All right. We have designated that the ALS stations must be signed off by one of the class instructors because we feel that we have a lot of experience with the testing process, and this is like a dress rehearsal for the exam. The BLS skill sheets you can get signed off by basically anybody who is an EMT at the National Registry level and has been tested on these skills. All right, so those are the National Registry skill sheets. They're due by the end of class. Let's go to clinical observation. There's a couple different things in clinical observation, and we start them at different times. There's the grid, which is the patient assessments, the IV log, which we're going to start as soon as possible, breath sounds and ventilation, which you can also start as soon as possible, and then seeing patients in the field, which I'm going to talk about next. So the sheets look like this. Excuse me. Here we go. This is what we call the grid. The grid is informed by the Vermont EMS student manual. They're the ones that say this is what you have to see: 5 chest pain, 5 adult difficulty breathing, 2 children with difficulty breathing, 5 altered mental status, 5 trauma, and the others don't matter. But if you want to list something, that's great. This is what you have to see. If you go back to the portfolio pages, there's a couple different ways you can complete that grid. You can complete it, some of the assessments that you perform on our simulation day, which is towards the end of class. So every single station that you go to will be represented on that grid, and you'll be able to count that as one of your patient observations. Sorry, I'm going to pause while I cough up a fur ball. Hold on. Of course, today I'm coughing a fur ball. All right, so the first way to get your grid completed is counting the patients that you participate in the assessment for during our SimLab day. The second way to complete the grid is when you go to the emergency department and you simply observe a provider assessing the patient. All right, so there's learning involved in listening to a physician or a physician assistant interview a chest pain patient and how they determine that the chest pain is acute coronary syndrome or it's non-cardiac chest pain. That's the whole point of this. The third way that you can complete the grid is to actually assess patients in the field. In order to count calls for your grid, you need to participate in the assessment. We're not telling your service that you have to become a crew chief in training. We're asking your service to let you perform an assessment under the direct supervision of a preceptor that they have selected. Okay, big difference. You get to stay with the patient for the duration of the call, so that means you can't give a nebulized treatment of albuterol, a bronchodilator, and then hop up front and drive to the call, because then you don't get to reevaluate the patient. And then at the end, you and the preceptor will talk about how the call went, what you assessed, what the intervention plan was, and how you saw that playing out. And once you do that, you need to fill out the AEMT clinical field experience preceptor documentation. So for every person that you see, every patient that you see in the field, and you count it on your grid, you have to have one of these filled out by your preceptor. Okay, so your preceptor fills this out and talks about the care that you gave, and it basically is just saying, yeah, we went over this. So that is the grid. That's how you fill it out. Now, back over here on the portfolio pages, a couple things that I want to just point out, that chest pain is chest pain, all right? And we're trying to teach the advanced EMT students that chest pain that is differentiated from non-cardiogenic chest pain, okay? So you might get a patient with tachycardia, with high blood pressure, with cardiac arrest, AFib, something like that. That's not observing the assessment of a chest pain patient, and that doesn't count. Pediatric difficulty breathing is just that. It does not include seizure. It's a respiratory-based complaint. All right, and so those are the two that sometimes people get hitched up on. So we're still on clinical observation. We've done the grid. The next thing is the airway and breathing sheet. And on this one, you're documenting that you've listened to 5 patients with abnormal breath sounds, which we'll go over in class. All right. And then you're documenting that you bag valve mask ventilated 5 patients in the field. Now, I don't know about you, but it doesn't happen very often that we're able to ventilate people. So the reality is that you're not going to get 5 BVMs in the field. We will simulate 5 BVMs in class, and I will sign you off. Okay? No one is expecting you to ventilate 5 patients in the emergency department or in the field. It's not going to happen. We will simulate it. All right? This is the clinical IV log. Once you've been signed off in class to do IVs on patients, we will get you started on patients in the ambulance. And every time you start an IV that's successful, and success is defined up here, you put the location, and it's either ED or ambulance, the date, details. It was an 18 gauge in the AC, and your preceptor's signature. So this is where we got to document the 20 IVs. We do have another little log of all the hours that you do in the emergency department, and that is your clinical observation. All right, so those are the 3 phases of skills. There's the class skills, the National Registry skills, and clinical observation. They're all in that portfolio, and you'll submit your entire portfolio at the end of class. I hope this helps. I'm super available for questions. If you want to email me a question, I might shoot the answer out to everybody, because usually there's other people with the same question. Thank you for listening. I appreciate it.